my name is Linda Rodriguez and this is my patient Cesar. We're going to perform a skin, hair and nail assessment today. I'm going to ask my patient first to undress completely and I'm going to put on some gloves.
Do I need to undress?
Okay, my patient is now undressed completely. I'm going to take a visual sweep of the entire body, noting any areas of sun exposure, noting for symmetry and distribution if there are any lesions. I'm going to inspect and palpate the skin and I'm going to keep the underlying organs in mind. I'm going to note the characteristics of the skin, the color, the thickness, the symmetry. I'm going to inspect for the general hygiene. I'm going to ask my patient to lift up his hands. These good areas to inspect for hygiene are the axilla and you can lower your hands and the perineal area. Now the skin color upon inspection is a dark tan, and there are no areas of skin discoloration. On the hands and feet there are some calluses noted, and a slight variation in skin color is expected. Now I'm going to inspect the lips. I'm going to note the color of the lips and I'm going to inspect the gums. It should be pinkish in color. Do you have any freckles?
No.
Okay, I did not see any freckles. I'm going to also, upon inspection, I'm also going to note for any odors. And if there are any lesions, I will report the size, the shape, location, and elevation. Examples of lesions are seborrheic lesions, cherry angiomas, lentiginous, which is the same thing as an H-spot, which you usually see more in older adults. Upon the assessment of the molds, I'm gonna use the ABC rule to rule out melanoma. The A stands for asymmetry, B for borders, C for color, and D for diameter. Borders should be regular. An abnormal finding would be an irregular border. The color should not be blue or black or variegated, and the diameter should be less than 6 millimeters. I'm also going to palpate the skin. The skin should be soft, smooth, and even. I'm going to check the temperature using the back of my hand, and I'm going to check the skin turgor on the forearm and check for mobility. I'm going to pinch up the skin and it should turn into place immediately. Now I'm going to check the scalp of the hair, the scalp and the hair. I'm going to note texture, color distribution, and amount of hair. Have you had any hair loss recently?
No.
Hair loss you would usually find in the temporal area or the crown of the head. If you find any hair loss, for example in the feet or toes, it may indicate a circulatory disorder. Next I'm going to check the nails. The nails should have smooth edges, should be pinkish in color, and the nail plate should be convex. I'm going to measure the angle of the base by placing a ruler. I don't have a ruler available, so I'm going to use this pen. The angle should be around 160 degrees. Anything above 180 is an abnormal finding. Next, I'm going to check the proximal and lateral nail folds. I'm going to squeeze each nail and I'm going to do the same thing to the toenails. While doing this, I'm going to note firmness, texture, thickness, and adherence to the nail beds. And lastly, I will communicate to my patient to perform a self-examination of the skin at home, which should include pretty much everything I just talked about. And that will conclude this assessment. Thank you for watching.